Well, here in the Brew, we have a drink and talk about all kinds of things. It's just like things you would talk about in the bar. And tonight, we've got a real crazy but controversial topic that you guys had a lot to talk about. Jersey Joe here, I in a box over there from Vegas, ready to crack a beverage. And Joel, are you ready to tackle the harsh and tough topic of healthcare in the U.S.?
This one's a rough one for me. No, I'm just playing. Yeah, let's do it.
Yeah, it is. He's got a little story. We all got some stories. We invite you to chime in and join our conversation as well. We got a bunch of your stories to get to, but we want to know, what's your opinion of healthcare in the U.S.? Good? Is it bad? What would you change? Or is it working okay for you? We want to know. You guys had a lot to say about this. It's a really good conversation. And it's a big topic, and we'll get to as much as we can. So, Joel, let's go to you first. What's your opinion about healthcare in the U.S.?
It's not good at all. I mean, for how rich of a country we are not doing well in the standings as far as life expectancy, all kinds of health problems. We have a lot more than a lot of other countries. It doesn't just have to do with healthcare. It has to do with preventing problems as well. But, yeah, we aren't doing great.
Yeah, I tend to agree with you. I think that we are having a serious problem with healthcare in the U.S., and it's just the factor that most of us just can't afford it. You can't afford to get sick. And it scares the hell out of me, and it also scares the hell out of me to get older. I see like the bills my grandmother has mounting up now for open heart surgery, knee replacements and cancer therapy, things like that. And you almost don't want to get old, right?
Yeah, I mean, especially with the way technology is going, because we're not even going to have jobs in 10 years.
That's the other crazy thing. Like, how the hell are we going to afford this in a few years? Because especially a lot of jobs now, more and more, especially here in the New York City area, are becoming freelance and don't have medical benefits. And if you don't have medical benefits, unless you're on welfare, you're pretty much screwed. Well, you know what? You guys had a lot to say about this. Let's get to our first comment right now, because Keith wrote in and said, absolutely not. The inherent issue is the profit motive. Healthcare should not be a capitalist venture. It is a societal imperative. Pay doctors, nurses, and staff well for their hard work and education. We don't need to pay insurance companies and stock investors. Single-payer, not-for-profit healthcare is the only humane and affordable choice. Keith had a lot to say there about that one, Joel, but what do you think about, are you scared about the future of our healthcare besides the whole job thing and, nobody's going to have a job or healthcare benefits?
The reason that he's right and that I am worried about it is because the way that it's going right now is the rich are getting richer and the poor are getting poorer. Mm-hmm. And he's right. It's capitalism is the main thing that's on healthcare right now. So the laws right now that are being put in place are making it for profit. They can just keep making more and more money, and there's nothing we can do about it. Like, my story this week. I had a slip and fall, cut my chin, and I lost half of 2 teeth when we were in Mexico.
Yeah.
And I just had to pay $2,000 out of pocket just like that. Otherwise, oh well, sorry, you're gonna walk around with fucked up teeth and pain and your chin all sliced up, bleeding everywhere. Like I had no other option because it is for profit.
Yeah, and here's one of the problems that I've had with healthcare. So I have glaucoma. I have to take expensive eye drops to keep the pressure down in my eyes, or I will go blind. Well, the certain eye drop that I was prescribed was generic from Puerto Rico, but as you know, Puerto Rico has no power, so they can't make the drop. I.e., there's a shortage of the drop in the U.S., so glaucoma patients can't have the drop. They prescribed me another one that was $300 for a teeny tiny little 30-day supply. $300. So if I would take that for 10 months, that's $3,000 to make sure I don't go blind. My doctor had to go through several other drops to find a generic one that I could take again to substitute for the one we can't get. There is no excuse for a tiny bottle of eye drops to cost $300. There's no way you can justify that. And it's even worse when you end up in the hospital and they charge you hundreds of dollars for a freaking aspirin. It's highway robbery, and it boggles the mind that it's actually legal.
It's legal because we are allowing people like Martin Shkreli to make the laws. Mm-hmm. I mean, he's protected. He can f*** people over who need cancer drugs to live because the laws allow him to do that, and people are just like, okay, well, those rich guys earned it, so they should be able to do it.
Yeah.
Oh, well, guess everybody's f***. I mean, the poorer you are, the more f*** you are in healthcare, that's for sure.
Yeah, and I'm going to say this, and I don't know whether I'm not a conspiracy theorist, but I believe if there's ever a cure for cancer, you and I will never see it because the insurance companies want the money to keep us, from our healthcare instead of keeping us alive and paying us off all at once. It's better for them to go ahead and keep charging us for hospital visits, for all the shots and everything, the chemotherapy if you get cancer. They would rather take your life and let you die for profit than giving you the life-saving drug. Because I kind of think it's already out there, cancer drug. Look at Tom Brokaw. He had it. He's been healed. I
was about to say, they have a lot of drugs. There's a lot of cures to things that we can't afford already. Mm-hmm. I don't know if cancer's one. We might be in the baby stages, or maybe they just are starting to figure out how to cure it and don't know how to introduce it to the masses yet. Or maybe it's just a private thing that only super rich people can afford. it could definitely be in the baby stages of that. Like, I would not rule that out. But yeah, you and I will never see it. Most people will never see it because you're not going to have the money to live.
And that's the other thing. Like, we keep electing these lawmakers down in Washington. Oh, I'm going to lower taxes. I'm going to make your health care better. None of them have done it. They talk, talk, talk. It's like every politician goes in there, they promise lower taxes and better health care. I'm still waiting for lower taxes because mine just went up here, and I'm waiting for better health care because that's not happening either. It's the BS promise that every politician makes, and they fail.
Well, since the topic is healthcare, I would just like to say that we are the richest country, and we still have people die at a higher rate because everybody needs healthcare. It's one of those things where it should be a right because everybody needs it. It's not the same as driving or gun ownership or all these other topics that they talk about in Washington, because this is something everybody needs. And if you capitalize life, which is literally like you're capitalizing life right now, indirectly, people are dying because of it. They're just dying. Like, it's happening.
Yeah, it's a shame, and you're right. They're actually not caring about life. They're caring about profit. Well, let's take a few more of your comments. We got a bunch more to get to. Darren chimes in with this one. It's a little long, but it's good. Services we paid top dollar for are literally given away in most places. If you lived in Canada and had a serious injury, you'd receive medication, doctor care, and emergency services all for free. In the U.S., that same scenario could cost you $10,000. It's inhumane. No, nothing will change for the sheer fact that it's a capitalist country. Capitalism, by definition, puts the best things on top and gives the rich the easiest access. In this country, they treat medical care like goods and services. You gotta pay for it. Okay, I mean, we could take that whole capitalism versus communism thing because they had to wait in long bread lines too for communism over there. But they are right. Like, people don't have to wait for these type of things in Canada. And like, Joel, when you and I, we were in Mexico, last week, and yes, you had to have treatment down there in Mexico for your chin, but you could see like different things that were for sale at the pharmacies there that you can't get here. Viagra, we'll take that for example. It's so regulated here, but there, it was just out and about for people to buy for cheap.
Yeah, or you can just have it for everybody, since we have a shitload more money than Mexico anyway.
Yeah.
Like, our country is filthy, filthy rich. So we can just have it for everybody. We choose not to. We choose to let people die so that rich people can be richer. But we have the option. We're not.
We have the option as a country. We just choose not to use it. Well, Rock for Guitar
we are
chimes
slugs
in.
for salt. That's what we are. We are slugs who like salt.
Yeah, we are. We're slugs that like salt and also wish we had better healthcare. We like healthcare too. Let's go to Rock for Guitar. He says, geez, Joe, this one is obvious. Single-payer healthcare for all. The system is a f***ed up mess because it is profit-based and never should have been. Throw out the Republicans and ignoramus president in November. Impeach his hideous ass and vote in single-payer healthcare. I'm not blaming Trump for this. I'm blaming every single politician in Washington because they just don't give a flying f*** about you, me, or anybody else. They care about getting in there and their own pocket, and it's damn sickening.
I don't know if I'm willing to blame every single person. I think we have to do a little bit better job of identifying who is actually going to fight for it and who isn't. But I don't think most people care about that kind of shit.
Hey, I'm chiming in right now. It feels like to me that nobody's down there fighting for me. I don't know if a single politician stepped up and said, I'm going to lower your health care, and has actually done it. Until somebody down there steps up and actually does it, I hold them all responsible. Every single one.
One person can't do it. I mean, it doesn't matter who it. If it's just one person and they get outvoted, you're f***ed. There's a ton. I mean, the process of checks and balances mean that we need more than one person doing it. No one person can do anything.
But it seems like they're not even like trying. Nobody's even introducing any bills. You don't seem to be making any speeches. You don't see anybody making a ruckus down there. They're doing nothing. They're like, they get in their little committees and, I'll vote for you if you vote for me and pay me off in the lobbyist bullcrap. And those healthcare lobbyists too should also be illegal because they're another ones that are like letting people die for profit. Again, I hold that whole system down there responsible, including lobbyists and all. They should all be sick to death.
The system is flawed, but you're jumping all over the place. There are politicians that do want single payer. Like the shit that you're talking about where you're pissed at everybody, there are a lot of politicians that want that. We have to do a better job of identifying who they are and making sure they get into it.
Then get them together and let's get something done because right now nothing's getting done. And when nothing's getting done, that's a job you done. It's like a baseball.
People have to pay attention in order for that to happen. People have to pay closer attention to politics. People don't like doing that because it divides people, but it's going to f*** you over if you don't. You have to really pay close attention to it.
Yeah, you do. But we also have a couple counterpoints of people that have chimed in. So let's go to our next one because Richard says, I am fortunate to have good health insurance. That's what my vote was based on. And Richard's talking about voting in the poll later on. And hey, I have good health insurance too, but it still wouldn't pay for my $300 a bottle for eye drops.
Yeah, me too. I have a great job and I'm out $2,000.
Yeah.
Like it doesn't, I have insurance with them, but that's a lot of fucking money for a lot of people.
Yeah, it is. Yeah, it is. And you had a dental procedure done too, which is even worse. Dental procedures are so expensive for no reason. They can patch the holes in my street here for cheaper than they can patch the holes in your mouth.
That's exactly right. Yes, that is correct.
Well, we got one more comment because Craig chimed in with this one, and he says, Obamacare in California is wonderful. Does California have some different health care that I didn't know about?
Yes, they do have healthcare that you don't know about if that's a surprise to you because they have the best economy in the whole country. If they floated off away from everybody else, they would be doing great, and we would be and part of it is Obamacare. The ACA has brought them completely out of the recession.
It's interesting because if that's working in California...
Craig is alive because of Obamacare. I don't know if you guys know that.
It's interesting because, you know, if it's working in California, then maybe there's some things that we could adopt for everybody that would help. Well, let's go to our poll right now because we asked you guys what you thought. Are you happy with healthcare in America? No surprise here. 57% said no, 36% said yes, and 7% said, I am not American. I had to put that option on there to make sure because we do have an international audience on our Twitter feed, so I had to give overseas people a chance to chime in too by voting I am not American. But I'm not surprised by so many people hating our healthcare according to the poll.
Yeah, I think somebody said they accidentally hit yes too on your mentions.
I'm not surprised by the outcome of the poll by 57% saying no. And yes, that includes the guy who accidentally clicked yes. But it was a good one too. So make sure you click that like and subscribe button down below so you don't miss any more of the hot topics here in the Brew or my other web show, Kicking Back with Jersey Joe, because this Thursday, it's a rescue at sea. Caught on camera, my 40th birthday in Cabo. If you saw it on social media, we rescued a millionaire from the sea. And you're going to see how it happened live Thursday on Kicking Back with Jersey Joe. And Joe, I want to get back to your point that you were bringing up. You were talking about your friends in the UK and how they handle healthcare over there.
Right. They pay a little bit higher taxes, but all their healthcare is free. So when they do need to go to the doctor, and keep in mind, everybody goes. At some point, everybody has to go. Mm-hmm. They go for free. They're not afraid to just go in because they aren't afraid of going completely in debt over it like we are.
Yeah.
So they pay less. Overall, the course of their lives, they pay less and they live longer.
And that's one reason I don't like going to the doctors. I'd rather find an over-the-counter remedy or just tough it out than go pay ridiculous amounts of money for not that great a service. I don't go to doctors. I don't like them. I go to an eye doctor and dentist just because it's a regular maintenance thing. I don't even have a family doctor because I haven't gone to a doctor in 20 years because I just am scared of all the extra charges that are going to come. And I know that's not exactly the best idea, but that's how I am.
It's not the best, and it sucks because I'm not just saying this because it's your age, because I'm going to obviously have to do the same thing. And people that are older than you or your age or any age really, everybody is going to have to go more and more frequently the older they get. Like you just have to go or you're going to get some shit that you find out too late and die.
Yeah, eventually the clock is going to run out. And just like running out, the time is running out on this show because we're running long. It was a hard topic. It's a tough one. Good discussion. We thank you for your awesome comments. We had both sides of the coin. Look, if anybody has any better ideas, hit us up on Twitter, JerseyJoe50, INICE4091, Jersey Joe here, INICE in the box over there. Thanks for watching, and we'll see you next time, I hope.